All right, good morning. Hi, Cindy. Rick posted this to me and he said you had mentioned it on his page the other day, Ric Kirby on Weather 217. And he asked, hey, could you ask the doc if there's anything that he knows to do for people that have gone through breast cancer? I'm guessing surgery, they've done chemotherapy, radiation, anything of that nature. And tamoxifen, letrozole is the other medication that they like to use for this. They are hormone blockers. Both of these meds are. And the key to this is that the tamoxifen they use pretty much any time. The other one they'll like to use more after you've gone through menopause. Or they'll use it at the end of using tamoxifen. The principle behind this is that when you look at breast cancers tend to be estrogen driven. Now, in my experience with it over the years and the patients I've seen, I can't recall one ever that wasn't estrogen driven. So there's a couple things to think about here. And one is, all right, you're taking the medication, and we know the side effects of these are endless. They're very, very long. And that's something that gets people alarmed. It makes them nervous because, the radiation, chemotherapy, all these type of things that they use, they also have lots and lots and lots of side effects. So you have to go back to the concept of supporting normal body function. And that's really the key to this. Can you support normal body function? And what does that mean? Well, let's use a little history here. When we look at breast cancer, one of the things we see all the time is that they'll talk about, genetic history. Mom and grandma and great-grandma and all these people had it. And your incidence of developing breast cancer, if that's the case, is about 2.5 times greater than the rest of the population. But here's something maybe you didn't know. If you have a history of constipation in your lifetime, okay, which is less than 1 bowel movement per day, if you have a history of this, then your incidence of developing breast cancer as a young woman goes up 4.5 to almost 5 times over normal. So when we look at that, we think, so constipation is double the risk of genetics. Now, what if you have both? What if you've got a grandmother and a mother and a sister that all have breast cancer or a history of it, and you're constipated? Now you're really playing with fire. So the key to this is to look at it and say, all right, what do you do? How do you help yourself? And if you've already been dealing with this and you've gone through the treatments that oncology offers, now what? Because the question was, well, what do I do if I don't want to do tamoxifen, if I don't want to do the other medications? And so we look at this and say, okay, well, you've got to stop the estrogen somehow. And then you've got to go back and look for that link. You got to say, gosh, if a bowel can do it and estrogen as a hormone can do it, then how do I slow down that estrogen production? Number one way, you've got to keep your weight within a normal limit for your height. If you don't do this, excess fat cells on the body produce estrogen. That's what happens, right? So now all of a sudden, gosh, my extra weight that I'm carrying around, it actually releases estrogen into the system. And now that same estrogen is the thing that feeds the bear. Now there's a product we use in our practice, it's called Breast Protect. And it comes out of a red wine extract, and it has very similar properties to something like the tamoxifen does. I've used it over and over for years in practice, and you have patients that just simply don't want to do the other therapy. Now, that's not my choice. That's theirs and their doctors. But the key is if they don't want to and they need something that'll help, it's a very nice product for that. Now, it's not as powerful as a drug. Nothing in the nutrition world is. There's just nothing out there. Drugs are fire trucks on fires. But the key to this thing is there are options. There are alternatives. Clean the diet up. Make sure the body can digest its food. Try to make sure it's eliminating properly. You've got to do that. And if you have a weight issue, you got to get it under control because it will produce this hormone. The last thing I'll leave you with is when you look at hormone production in the body, after you go through menopause, the adrenal glands take over your production of estrogen and the balancing of most of your sex hormones. So we look at that and say, well, gosh, if that adrenal gland was already beat up and tired beforehand, if it was already running to the ground, I'm already stressed out, and then I ask it to take on somebody else's job, it can't do it. And that's where we get in trouble. So I hope this helps you. There are alternatives out there. I like the Breast Protect as one of them. They make a product called Prostate Protect as well for the male hormone. But it's kind of the same concept, right? The prostate, the breast tissue, all those are similar. The key to it, if you have something going on like this, clean the diet. Make sure the body can digest its food. Make sure it can eliminate its waste. Support your lymphatic system. And then on the outside, you got to go looking for that emotional bear. I'm Dr. Sean McCaffrey. I hope that helps you.